Every 60 seconds, an American woman dies of heart disease.
So it's far more prevalent than breast cancer. Heart disease is a women's issue.
Dr. Afriye Amerson, an OBGYN in North Jersey, says it's important for women to know that heart attack symptoms in women are often very different than the chest, jaw, or arm pain men describe.
Fatigue, not quite feeling like herself, not having the stamina, not having the energy, can't get through the day.
Dr. Amerson says those symptoms should send a woman running for a cardiac evaluation. Sarah Lee Kessler for the new 710 WOR.
It's Get Well Wednesday, and it's brought to you by Crest Pro Health HD. Crest Pro Health HD is a breakthrough two-step system that isolates key ingredients for outstanding oral care results. Upgrade from ordinary toothpaste to new Crest Pro Health HD. Our doctor this morning is Dr. Afriye. Did I say it right?
Yes, you did.
Amerson?
Amerson, yes.
Hi, doctor.
Good morning. How are you?
I'm good. The topic today, we have questions for you on vaginal health.
Excellent.
All right. For starters, let's see. Is vaginal discharge good or bad?
Well, vaginal discharge can be either good or bad, but the fact that a woman has some discharge in and of itself is not abnormal. So all of the openings of the body, from the nose to the mouth to the vagina, all produce some form of moisture, and that's just the normal cleansing as the old cells die.
Okay. What age is normal to start seeing any vaginal discharge?
Puberty to menopause. So it's the reproductive years and the production of female hormones that causes the cellular turnover to be greater and that causes the discharge. So a young girl, for example, should not be producing any discharge and should be taken to her doctor if she's having that symptom.
If she's not started her period? Or...
That's correct.
Okay.
That's correct.
Should women get rid of fragrance body wash?
Absolutely. So a fragrance, a perfume, or anything of that sort does not belong in the vaginal area at all. So if she uses it overall on her skin in a body wash, that's okay. But a vaginal wash should only have either vinegar or baking soda in the right composition. Fragrances are out of order.
Pros and cons of douching.
So the pros of douching are that at a maximum of one time per month, using either vinegar or baking soda in the right composition, this can not cause a problem. This can be a simple cleansing. Douching is not required. So the disadvantage is that if a woman is trying to treat an infection by douching, trying to prevent pregnancy by douching, trying to stop an STD or treat an STD by douching, that's inappropriate. It's not going to work. It can worsen an infection. If she over-douches, she can rob her body of healthy bacteria, and then that's going to cause an infection.
What should men be aware of as it relates to their wives, girlfriends, and daughters?
You know, when men often know the vajayjay better than their female counterparts. And so it's very interesting that our partners actually generally pay more attention than we do. So I encourage women to pay more attention, and I encourage their partners to simply be aware of who they are. You know what your partner's normal scent is. You know what your partner's normal texture or feel is. So actually, you're a very, very good judge of when something has changed. And you simply want to bring it to that woman's attention.
Okay.
How do you do that?
Yeah, how you do that?
What's the words you use? Say, baby. I mean, what do you?
You start
Need
with.
to holler at you about something? I mean, what do you do?
Well, you know, do it like you guys always do it. You just get straight to the point. So the thing is, don't be That's it. That's right. Don't be afraid to look at it.
Yeah.
Don't be
In other
afraid
words,
to know what
don't
it
beat around the
smells
bush.
like.
Is that what you said?
Oh, my God.
There you go.
I'm just trying to.
Just trying to get some understanding here. Okay, next question. How does condom use affect vaginal health or pH balance?
Well, the condom can protect a woman's pH balance, which is normally acidic, between 3.8 and 4.5. And the condom can prevent the interaction with semen. Semen can actually throw the pH balance of the vagina off. So that's one advantage of the condom, in addition to prevention of pregnancy and protection from STDs, but also a disadvantage. Some women are latex allergic, and latex allergy is something like most allergies that you can develop over the course of your lifetime. So you have to be very conscious of whether your body is reacting negatively, irritation, redness, soreness, an abnormal discharge immediately after condom use, and that seems to be consistent, and that can be indicative of an allergy. Also, there's certain condoms that will have powders or other substances, even the lubricant, that may not agree with that particular woman's body. So it's important to be mindful, again, of yourself, to know what you look like, feel like, smell like, and be sensitive to changes. Certain types of condoms are going to not prevent against STD, lambskin.
Okay.
Be aware of all of those things.
All righty. All right.
All right.
Now, if I didn't ask all the questions and you have questions to the doctor,
There you go.
646464, she's going to be around for the next hour to answer your questions on vaginal health.
Did you all learn anything?
Yes, I did, Sybil. Yes, I did.
To never beat around the bush.
Really?
That's what I learned.
Thank you, doctor.
It is Get Well Wednesday at 27 before the hour. Get Well Wednesday is brought to you by Crest Pro Health HD. Crest Pro Health HD is a breakthrough two-step system that isolates key ingredients for outstanding oral care results. Upgrade from ordinary toothpaste to new Crest Pro Health HD. Dr. Afriye Amerson is an obstetrician and gynecologist, and she says some things that you may have read from Black Woman for Wellness, talking about hair care products may cause fibroids. Dr. Amerson, good morning. Welcome to the show.
Good morning, Skip. How are you and the team this morning?
We are wonderful, Doctor. Now, I think this is so interesting. Is it true that many of the products marketed to and used by Black women are rarely researched for toxic health consequences?
That is true. And it's not just true for Black women, it's true for hair care products across America, that they're not FDA regulated. And so the ingredients and the compositions and how they're manufactured and how that is disclosed to us as a public is very much up for scrutiny. And overall, what this report by Black Women for Wellness really highlights is sort of this concept of go green, Skip. You know, we're all supposed to be becoming more aware of cancer-causing chemicals and chemicals that can disrupt our immune system, our endocrine systems, and many other systems of the body that are natural. So we know now, thanks to Black Women for Wellness, that there are particular chemicals that we can look for and avoid in our use of Black hair care products.
So this includes hair relaxers?
Hair relaxers in particular, Skip, can be a problem because Black women can get burns to their scalp, other lesions to their scalp from relaxers, from bleaches, from deep dyes, and these are the type of things that have been associated with the development of fibroids, the development of cancer, the development of early puberty, and many other problems that we're seeing within Black women and women of color overall.
This is a 60-page report. It's called Natural Evolution's One Hair Story, and it's 5 years of research around the topic and information about this exposure, and especially amongst African-American women. And it says that the Black hair care products are found to be the most toxic beauty products on the market. So the question, doctor, is why?
Well, Black women, number one, use hair care products more than any other ethnic group. And the report highlights how many billions of dollars we as Black women spend on our hair. So that's one thing. Secondly, we are using things to straighten, to detangle, to dye, and to bleach our hair.
The
We are
detangler is
Yeah.
said to be bringing on early puberty for black girls.
That's exactly
That's
right.
crazy.
That was actually published in the Annals of Epidemiology study. So black women need to be mindful of particular product chemicals like propylparaben, like DMDM hydroantoin. So there are many things that if we look for these ingredients and we avoid them, particularly in young girls, so the use of hair detangler and animal placenta has been associated with a disruption of a young girl's hormones and her endocrine system that can cause early puberty. And guess what, Sybil? Early puberty is associated with a higher likelihood to develop fibroids.
Jeez. And so, especially for hairstylists who are, in touch with this for 5 days out of 7 and on a prolonged basis, what do hairstylists and especially as parents do? What do we do in looking for the products? And if you could name some of those chemicals again.
Okay. Well, hairstylists, first of all, should all check out this report. All black mothers should check out this report. As you referred to it, Sybil, Natural Evolution is a phenomenal 60-page, very in-depth report that really talks about many different effects on the body, from things as simple as an allergic dermatitis to the skin to something as complex as the development of cancer. And so they even cite different journal articles going back to 1994. There's a journal article about how hair dye can increase our risk for cancer.
Oh, dear God.
So, so again, the report is worthy of reading. And some of those chemicals, again, propylparaben is one of the chemicals. That's known to be a toxic thing to the skin, and it disrupts our immune system.
Jeez.
Another one is the initial DMDM and the word hydantoin. And that, again, is known to be something that releases formaldehyde and many other toxic chemicals that can be absorbed through the skin into our body.
This is amazing, doctor, because the black hair care industry is a multi-billion-dollar industry, and we never thought about that before. But thank you so much for the awareness, and you have a great day. By the way, Dr. Afriye Amerson will be available to get your questions from the Text Time Club for the next hour.
Get Well Wednesday. Ladies, we're talking about fibroids in black women, the silent war. And our doctor this morning is Dr. Afriye Amerson. And she's been on the show before. Good morning. Doctor, how are you?
I'm doing great, Tom. How are you this first Wednesday in May?
All right, then. Okay, first of all, what exactly are fibroids?
Well, Tom, fibroids are benign tumors of the muscle layer of the uterus. And these benign tumors can begin to grow most commonly in a woman's 30s and 40s, but the size can vary tremendously.
Okay, you got to be grown to have fibroids, huh?
And is it true that you have to be grown? Because I've heard some, and that might be the exception, just young girls, teenagers already experiencing the pain of fibroids.
So teenagers who experience pain overwhelmingly are experiencing pain that we just call dysmenorrhea, painful cramps, and they are not having an anatomic deformity of their female organs at that young of an age, Sybil, but it certainly can happen. There are always rare exceptions, but for the most part, you're going to be talking about absolutely, as Tom said, grown women who are experiencing these dilemmas.
Okay, and what are the symptoms of fibroid?
Well, Tom, a woman can bleed very heavily during her menstrual cycle, whereas she previously had a moderate flow and she's noticed a significant change. That can be a major symptom that needs to be evaluated by her doctor or provider. Also, she can have pelvic pain, and that can be constant to only with her cycle to only with intercourse. So there's a lot of variety in our symptoms. Of course, if a woman is losing a heavy amount of blood, then she can, as a result, become anemic. And then that has its own symptoms that include fatigue, dizziness, just low energy.
inability to really have a normal thought process. So even cognitive functioning is affected if a woman is anemic enough.
And how can a man be supportive of a woman dealing with fibroid symptoms?
Yes.
Well, get to know your woman. In other words, make her comfortable even sharing with you what her symptoms are. Because, Black women, we are very personal about our menstrual cycles. And it is not something that your mama taught you to talk about with anyone.
Mm-hmm.
But certainly your intimate partner needs to know if you're having painful intercourse. Perhaps there are other positions that would be more comfortable for you. They need to know what's going on with your mood. If you happen to be bleeding for 2 weeks, that could contribute exactly to how they're being treated and what the dynamics are in that relationship. So as always, open, honest communication in a non-judgmental setting is best to keep that relationship intimate.
How do we get them? What is the cause of this?
And why do Black women disproportionately suffer?
We are disproportionately suffering, Tom, on every level when it comes to health, morbidities, and mortality. So the exact cause of fibroid, Sybil, is not known, but some of the contributors we know, again, number one, female hormones. Mm-hmm. So this is not something that happens way after menopause, and it's not something that happens way before puberty. And again, most commonly right in the fertile crescent of her life, when she's been pumping out several decades of hormones, is when this occurs. But also, Tom, being overweight is a risk factor. And here again, women of color and Black women in particular, we're disproportionately represented when it comes to people that are overweight in this country. And so getting in shape is one of the steps at reducing your risk personally for the development of fibroids.
And so is there also a way to reduce the size as a result of that so that you don't have the issue, or to avoid it altogether by losing weight early on?
So always prevention is the best solution, because an ounce of prevention is worth a pound of cure. Once the fibroids have developed, then the things we know that can shrink fibroids are things that are medically prescribed. Mm-hmm. There are many, many old wives' tales and things that we will hear about in terms of herbal remedies. Mm-hmm. And I say discuss those things with your provider. Your provider should be open to that discussion, because most of those things are not going to cause harm. And so it's worth allowing a patient who's not having severe symptoms to explore and allow them to feel that they're empowered as part of their health journey. But what we know will shrink the fibroids, again, is going to be prescribed medication with a healthcare provider that specializes in fibroids. And, of course, there are options to surgically remove them. But there are those fibroids where a woman's not having any symptoms at all and is not bothered and may simply need routine monitoring for the size and the change of the fibroids over time.
And what about hair chemicals?
Well, Tom, we talked about black hair chemicals. You're always on top of all the latest news. And when that report was released last May, we talked about some of those issues. There are particular chemicals that can be triggers for a woman to have an abnormal hormonal response. Young girls can have an abnormal response and enter puberty prematurely. And again, Sybil, that gets back to what you're saying. Is this young girl being exposed to such a heavy level of hormones, nutritionally as well as chemically and environmentally, that abnormal things that shouldn't even be happening at her age are happening? And this can continue to happen through our life cycle. So women have to be particularly cautious and learn to read labels, even with our perms and our other forms of hair coloring, et cetera.
Ooh, all right.
That's a lot to think about.
When you're just trying to get your hair done. Wow. Jeez. All right, Doc.
Thanks,
you're going to be
Dr.
around for the next hour to answer any questions about fibroids and black women, the silent war. Plus, you can get more information on blackamericaweb.com. Dr. Afriye Amerson, thank you so much.
Thank you. I appreciate you guys.